Ladies, gentlemen, and colleagues, good morning to everyone. Thank you very much for joining us in this online international conference organized by Eurasia Research and Health Biological Association in order to share some ideas and scientific experiences together. My name is Nasser Drareni. I'm Professor of English Specific Purposes in Different Sciences from the University of Blida2 in Algeria. Today, we're going to present a paper titled Promoting Medical Learners' Effective Oral Communication Skills Using Concept Maps and Deep Learning in Clinical Learning Case, University of Medicine, Algeria. The research paper has divided into the following three main parts. At first, we'll be looking at the salient elements of our inputs and outputs of the chain clinical communication skills using concept map through deep learning as follows. What are clinical communication skills? What are effective clinical oral communication skills? What is Calgary Cambridge model of teaching clinical communication skills? What is objective structured communication examination? And what is concept mapping and deep learning? And finally, what is self-mapped learning pathways through deep learning? At second, our research methods, and finally, at last, our conclusions and recommendations to summarize the main results of our study. As usual, we'd like to start the presentation with a map to show the salient elements of our study, and then we'll ask our fundamental question. So, as we know, and as can we see from the map, it's clear to us the difficulties and challenges of the chain clinical communication skills in clinical learning and also promoting clinical oral communication skills due to several obstacles such as the ability to convey is recognized to be one of the key components of effective clinical learning and clinical practice. So to be good clinical oral communication skills are consistently rated of high importance for clinical competencies. Second element, there are 5 main types of communication we use on a daily basis: verbal, oral listening and hearing, non-verbal, written and visual. With all of these communication styles it's most effective when we know how to actively listen, observe, and empathize. Developing these soft skills can help we better understand, share health problems, and respond thoughtfully. Third element, effective clinical oral communication skills, including being able to listen and respond and to convey data, information, and knowledge clearly, consistently, and sensitively to doctor-patient relationship and also other health professionals. And finally, general public. Fourth element, the Calgary Cambridge model of the chain clinical communication skills using concept map through deep learning provides structure to ensure smooth flow of the consultation and the base of many medical interviews. This method of the chain should allow the clinical learners to associate concepts such as disease and illness as well as clinical skills. Last element, the essential components of clinical communication skills are linked to clinical content, clinical knowledge, clinical skills, and clinical attitudes. So objective, structured communication evaluation is the best test that can really and effectively assess clinical communication skills performance. It has been used to evaluate clinical skills and has been considered a reliable method to assess the clinical competence. So our fundamental question is how concept maps through deep learning could be used to promote clinical oral communication skills in clinical learning. So we return to our answer at the end of our presentation. Right now, let's move into our first part related to our the salient inputs and outputs of the study, characterized by 7 elements as follows. First element, what are clinical communication skills? Clinical communication skills are vital to a healthy, efficient workplace. There are 5 main types of communication we use on a daily basis: verbal, oral, non-verbal, written, and visual. Second element, what are effective clinical oral communication skills? Effective clinical oral communication skills lead to better health outcomes, including higher satisfaction, improved illness and disease, understanding to treatment, prevention, and money management. Third element, what is CCM of the chain clinical communication skills? So the Calgary-Cambridge model of the chain clinical communication skills is a practical model that incorporates the physical, psychological, and social aspects of the consultation. Fourth element, what is objective, structured clinical examination? The objective, structured clinical examination is defined as an approach to the assessment of clinical communication skills and clinical competence. It has many characters of good assessment instruments such as objectivity, validity, content, and finally construct, etc. Fifth element, what is concept maps or concept mapping? Concept map is an active learning process to organize and encode new data, information, and knowledge in order to promote clinical communication skills. Sixth element, what is deep learning? Deep learning is a type of representation learning in which the algorithm learns a composition of features that reflect a hierarchy of structure in data. Last element, what is self-mapped learning pathways through deep learning? The SML through deep learning is a type of machine learning based on artificial neural networks in which multiple layers of processing are used to extract progressively higher level features from data. So SMLP are a method for designing course content in a pedagogical fashion to allow for clinical learning, autonomy, and self-regulation. Right now, let's move into our second part, our research methods characterized by 5 elements as follows. First element, our aim. The study attempt to provide an introduction of concept map through deep learning as an effective tool in order to promote clinical oral communication skills in clinical learning. Second element, about implication for clinical oral communication skills as an influential tool to promote clinical communication skills of the essential components that includes the ability to find and use appropriate elements of clinical communication, clinical communication skills. Second element, our data collected. Participants were fourth-year medical learners, 40 clinical learners from the University of Medicine, Algiers, attend the innovative program by using the 3 instruments as follows: the pre, post tests using OSCE, the average normalized gain to assess the level of clinical oral communication skills, and finally the 10-item question about using concept map through deep learning in clinical communication skills. Fourth element, our subjects. The subjects focus on a range of topics related to clinical learning, such as clinical areas, effective clinical oral communication skills using artificial intelligence in clinical communication skills, using unsupervised learning, self-mapped learning through deep learning in communication in clinical communication skills, and finally clinical data science using deep learning. Last element about our procedures, the clinical learning process is shown schematically in table 2 in appendices, characterized by 3 elements. First element, recognize clinical communication skills from the topics, then using concept map through deep learning to determine different components of clinical oral communication skill, and finally identify different types of clinical oral communication skills such as poor, bad, good, or effective. Last part of our study related to our results, recommendations, and conclusions. So first element about our results. Overall, clinical learners, after using concept map through deep learning with medium level of effective clinical oral communication skills, more than 37% obtain higher scores compared with clinical learners before using concept map through deep learning with low level of effective clinical oral communication skills. The performance of clinical learners was significantly in the end of concept map through deep learning sessions, but not in a beginning of teaching. Second element of our last part, our recommendations. So we suggest to use a wide variety of teaching and assessing clinical communication skills model in our lectures, that including the 3-function model, doctor-patient model, McQueen's disease illness model, and other types of assessing clinical oral communication skills such as CBS, case-based discussions, and DOPS, direct observation of procedural skills, and certainly our lectures in order to promote and increase the core of clinical oral communication skills in clinical learning. Finally, last element, our conclusions. The study showed that effective clinical oral communication skills positively correlates to a learner's concept map through deep learning performance. G, more than 37% clinical learners with concept mapping through deep learning obtained a medium clinical communication skills and perform better in their scores, and certainly found them very interesting and effective tool for clinical learning process good feedback of clinical learning experience and increasing clinical communication skills. However, despite its wide acceptance, evidence is lacking on how effective concept map of deep learning is in enhancing clinical oral communication skills and clinical decision making using self-mapped learning pathways. So concept mapping, self-mapped learning, and concept mapping through deep learning are not suitable when huge clinical data science and knowledge base have to be delivered to clinical learners. So finally, in the end, we'll find all references and information with all data and procedures of the study.